Oh, we're good. I'm sorry. I'm not paying attention. I'm Pierre from 93.1 WPOC. And joining me today, I'd like to introduce my new friends, Jennifer Seiler, Certified Child Life Specialist at the Pediatric Emergency Department and Inpatient Unit at GBMC. Thank you so much for being here.
Thank you.
And Cristin Bailey, Nurse Manager at the Pediatric Emergency Unit. Thank you so much.
Thank you for having us.
Cristin, I want to start with you. Describe the unit. What types of patients do you see there?
Our unit is a combined model where one half of the unit is pediatric emergency or ED beds, and the other half of the unit are inpatient beds. We have 5 ED beds and 8 inpatient beds, and if the inpatient beds aren't full, then we flex that side and put emergency patients in those beds. We see a variety of patients. We see illnesses and injuries. Right now we have a lot of respiratory complaints coming through, asthmatics. There's a respiratory virus that's causing young children to wheeze and have difficulty breathing. We see kids with vomiting and diarrhea, abdominal pain, and injuries, lacerations, and broken bones, and sprains and strains, and that kind of thing. We have a Pediatric Safe program where we see children who are victims of sexual assault, and we also see children with psychiatric complaints.
What is a Certified Child Life Specialist?
So we are members of a multidisciplinary team. We help patients and families cope with hospitalization, and we do that through play, education, preparation, support for procedures, tests, and things that they might encounter during their hospitalization.
What does a normal day look like for you?
So there's not really a normal day.
Okay.
So GBMC, we have child life specialist staff from the hours of 12 to 10 p.m. So usually we'll come in and we're one child life specialist per shift. So we check in usually with the inpatients first. They're usually on hospital time, waking up a little later. So we'll check in with families, see if we can provide any normalization to help just with their hospital stay, normal crafts, games, those kind of things. We'll also check in with the medical team to see if there's any particular goals that they have for this patient. And we're going to help work with those goals. So for example, we might have a patient who's recovering from appendicitis. They had surgery.
Yeah.
The next day, they really want them to get up and moving. For adults, we don't want to get up. So for kids, they most likely don't want to get up either. So we have ways to help motivate them. We've created a photo scavenger hunt for the unit.
Oh, great.
So they will, instead of focusing on their pain, it's something exciting, something new. They get excited to find things on the unit and off the unit. For respiratory, we're in our height of our respiratory season. A lot of our patients are in isolation. So we might come in and provide for a younger patient a play mat. For that patient to go and play on the floor.
Yeah.
A lot of parents don't know how to engage with their kid because they might be hooked up to an IV. They might not be as mobile as they used to be. So we provide that opportunity for them to have a safe area, tell them how they can engage, and get them up and moving, which is really important to get their lungs moving when they're sick with a respiratory illness. And also promotes that child-patient or child-parent bonding as well, so they can do that while they're still in the hospital. For an older patient, we might come in and decorate a pinwheel, create one, decorate it, and then have different times during the day where we practice taking those deep breaths to exercise those lungs. So those are some goals that we might be approached by medical team to help support them. And then in the ER, we are usually dealing with high anxiety, a lot of pain, a lot of stress, because these are not usually planned visits.
Sure.
So we are working with them, we're building quick rapport, and then we're also assessing if the child understands why they're here in the hospital, any misconceptions they might have. We also want to establish trust and to show that the hospital is a safe environment, and this is a place where kids come to get better and to feel better. So we are doing all of that while building quick rapport, so we might just provide normalization activities, and we also might prepare them for procedures or tests and examinations that they might be encountering. That is a typical day. It's a lot.
I'd like to say really quick too, before we started doing this live interview, Jennifer was very worried about being too nervous for this, but you're nailing it.
Oh, thank you.
You're crushing it right now.
Well, thank you so much.
Also, as an asthmatic, I spent a lot of time in emergency rooms when I was a child, and it is a nerve-wracking experience. So you don't really know what's going on. Like, you know you can't breathe, you know you're struggling. You're on this room and you're hoping that someone can help you out, but you're not really sure what's going on.
Yeah.
So having these opportunities and having these things there must be a huge relief for the kids and for the parents too, because they're trying to explain it and they're trying to help their kid get through it as well.
And a lot of times this is their first touch point. Sometimes they're with hospitals. it could be their child's first hospitalization, or the parents were fearful of what's to expect. So we work with the entire family.
Well, I imagine that the impact has been big, but what kind of impact has Child Life made since their inception at GBMC?
It's been tremendous. Initially, staff was very resistant to their services. I think it was more of a fear of the unknown.
Okay.
And once they started working individually with staff members and teaching them positions of comfort, staff recognized how well that they would fit in to their daily activities. We are so appreciative that GBMC has funded our Child Life program, and because most community hospitals don't have a Child Life, so we're very lucky.
Listening to the way you describe it, it seems like it's almost an essential thing in my mind to have that there, because it's never fun to go to the ER no matter how old you are. But if you're a kid, your brain immediately starts going to all these negative things, and you're so confused and you're scared. As an adult, you at least have an idea, an understanding of what the ER is all about and what might be coming your way. But as a kid, it's a whole different world. So to me, hearing you describe this, I'm surprised that other places don't have more and don't put more emphasis on this.
Right. The unit is scary. It's a foreign environment. It's not as friendly as it could be because there's a lot of equipment around.
Sure.
And then we have to do procedures that are scary, and Child Life helps the kids to understand, prepares them for the procedures, and also distract them during the scary parts. So it's very helpful. I get a lot of feedback from parents that they're so thankful for Child Life's participation in the hospital stay.
So what ways can people that are joining us today on Facebook Live support Child Life services at GBMC?
So there's various different ways to support our program. That we are always in need of supplies and resources. So a big part of our job is normalization. So we provide the arts and crafts, the board games, the iPads, the books, so things that you have at home that your child has comfort with or finds joy in. You usually, for an ER visit, don't think to pack those things because you're rushing out the door. So it's those.
Sure, your mind's going in a million different directions.
Yeah, exactly. I gotta go. So we want to make sure and ensure that we have those items that is going to make the hospital a less scary place. So people can donate, like I said, toys, books, games, those kind of things. They have to be new. That's the only thing that we have for infection control.
Sure.
We also accept monetary donations. So that could be, for supplies that we can go out and buy. We also, and I'll talk about this later, monetary donations also help to fund our salaries. So we hope to have more child life specialists in different pediatric settings at GBMC. So, that money would definitely help fund that. We also have a volunteer program where people can come and volunteers can help maintain a safe, clean environment, help clean our toys, organize our resources, and also spend time with patients in their room, maybe give a caregiver a break so they can take care of themselves. So they're an extension of our play portion of the Child Life program. That's how you can help.
If somebody joining us right now wants to learn more, or if they want to donate, or they want to become a part of this, where should they go to do that? I mean, can they find the information? I keep pointing like that's the Facebook page. That's just where the video is. But should they go to the Facebook page? Is there a website they should go to? What's the best opportunity for them?
So I think we heard that they can comment with questions, and then it will be directed to me, and I can contact them of ways that they can help support our program and ensure that Child Life stays at GBMC.
Perfect. I saw you had a little doll here. What is this that you brought along with you today?
This is kind of a staple, and I hope everyone can see, a staple resource that we use for teaching patients about things that they might encounter in the hospital. It's called a hospital or blank cloth doll, or a hospital buddy if you're working with a boy. And so the really cool thing about this resource is anything that happens to a child can happen to Buddy as well. So it gives the sense of control back to the child, that they can really understand what's about to happen. They can familiarize themselves with medical equipment they're going to see used on them, and they can practice seeing how everything works with Buddy. So I already have an IV already placed in, but we use real medical equipment, like I said, so they will go through and learn about all the steps of an IV, actually place the IV, push the saline or medicine through so they can see how it works. I also always have an IV catheter on my badge to show kids because there's a lot of misconceptions that needles stay in, and it's actually just that plastic straw that stays in their vein. So that is, one way we can do for those kids who need nebulizer treatments.
I didn't know that. I had no idea. Whenever I go to the hospital, not that it's like all that often, but I always would be so careful about moving my arm thinking the needle was in there. I had no idea.
And a lot of parents think
not just
that.
Kids.
No.
I need one of those next time.
Yeah. So a lot of our preparation is actually for parents as well.
Okay.
So the hospital can be less fearful. And so if they have a positive experience, then hopefully they'll utilize healthcare more often as they grow up too. So it's for parents as well, for their education. Things like nebulizer treatments, they can practice that, or we have anesthesia masks for induction, they can practice that, blood pressure for vitals. This is another great way you can donate these blank cloth dolls. They are sewn, hand sewn, so if you are a sewer or know a group who wants to make these, we are always in need of these. And also there are patterns for hospital gowns to kind of personalize the buddy, the markers to help kind of create the buddy to come to life. Kids express a lot of their fears and learn through play, so that's another reason why we use this, that while we're learning, they're also playing, and we're assessing, their understanding, if they, what they're scared of, what the stressful part's going to be, and we'll develop an individual coping plan to help them get through that procedure. So maybe it's blowing bubbles and practicing taking those deep breaths and visualizing that pain or scaredness being blown away with the bubbles. Maybe it is watching. A lot of kids like to watch, and that's their coping. And we'll talk about ways that they can do that safely. Or maybe it's doing a nice Bible or singing. So there's different ways, that we use this, and then also match interventions and coping strategies to help them through. Kristin mentioned positions of comfort. That's one thing that we definitely changed practice when we started. A lot of kids were laid flat for procedures, which a lot of research has shown is the most stressful position for a child because they have no control, they don't know what's going on, they can't see what's going on. So we incorporated parents to be a part of procedures now, which gives control back to parents as well, because that's their main role, is to support their child. So instead of being laid flat for procedures, a parent might give a child a bear hug to hold them tight, to remind their body to stay still. Or they might just be holding their hand. But they are definitely a big part of the procedures now, which was a big shift in practice.
As we talked about earlier, there's no real, no day is the same. You get different patients, you get different atmospheres that happen every day, but what is one of the most common ways that you assist children in the ER? So
basically the foundation of what we do is play. Play is the universal language for children. We don't need to speak the same language to have them play. So a lot of our interventions are play-based. So you see these teaching dolls. We develop, if there's a goal in mind, going back to like respiratory, I've definitely done Candyland, and every time you pick a double card, you have to blow bubbles twice. Or you have to blow that pinwheel. So we incorporate play with helping them cope and learn about their hospitalization.
Must make it a little bit easier on them too. That's great. And are child life services covered by insurance?
So we do not bill for our services.
So
families can be rest assured that we can come in and play and teach them about why their child is here, and they will not be billed. But that being said, hospitals need to find funding for child life departments to function, and that's why we're very grateful for the donors that are currently supporting our child life program. We're hoping to get the program endowed, so we'll stay there and also expand into other pediatric settings within GBMC.
Well, it sounds like a great program, and so monetary funding, obviously a big thing for you, but also looking for donations for toys and other different items. And if somebody watching right now is interested, again, you said just a comment here on the video, they'll be directed towards you.
Yep, and we'll get back to you.
That's perfect.
Yeah.
I know we already had a question here that I wanted to ask you. Laura had a question. She says, Child Life has been a true asset to the SAFE program at GBMC. Taking care of children who have been abused is not easy. Could you please talk about how you help the forensic nurse during the exams, and why your job is so important with these special population, or with this special population?
Yeah. Well, thanks, Laura, for chiming in and your question. Yes, so we have been very lucky in the sense that we have partnered with the SAFE program and Laura and her wonderful team. These particular patients come in because they've gone through some kind of trauma. And in order to get evidence, there's a very invasive examination that happens. So we might use a blank cloth doll, we might use a Barbie, and we're going to take them through, just like we would go through the steps of a procedure, we're going to go through the steps of an actual exam. So we'll start with getting a little Q-tip and practice, putting it on the top of their head, and then practice going down their body. So we're going to let them see kind of what's going to happen to them. We're going to show them, we have a prep book that shows the special room they're going to go into, where parents will be. So we're just preparing them for every aspect, including the parents, of what to expect. And during that, we're also hoping to build really quick rapport with them so they trust us.
Sure.
That's a huge thing, trust. We also are very big, no matter what the setting of where they are being seen, that there's no surprises in the hospital. So if we can make things more predictable, it lessens anxiety for everyone. So we try to make, especially these kind of cases, more manageable and make them feel very empowered leaving it, that they were able to get through something so traumatizing and was able, to have a positive spin on it.
We've referenced the SAFE program a couple of times here, but just in case someone watching or listening right now doesn't know what that is, can you talk a little bit about what the SAFE program is in general?
The SAFE program it stands for Sexual Assault Forensic Exam.
Okay.
And we have a SAFE program at GBMC for all ages. We used to just see adult patients, and within the past couple of years, started seeing pediatric patients as well. Our nurses partner with the police department, and they do the exam and do all the necessary paperwork. But it's a wonderful program.
Yeah, I mean, I imagine it's never comfortable for anyone to have to report something like that or have to be a part of something like that. But for a kid, I imagine it's really hard because I'm sure it's very, very confusing on many levels when something like that happens. So. And
it's really big to have, having someone who can try to normalize the experience, because it's easier to do a procedure on a child who's more cooperative than resisting. So that's another big piece of why we try to meet them very early and prepare them, because we're also here to support the medical team as well. No medical team, no nurse or doctor likes to do things to kids who are upset or scared. Yeah. So we are definitely trying to minimize or increase their cooperativeness during procedures.
Do we have any questions yet? No? Okay. I know she's got a gigantic sign with a big question mark on it. Can I show that? Can I say this is great? She brought this in today, so when we got questions, she could raise it. So this is really good. But I wasn't paying attention, so I wasn't sure. She raised it behind my back. So the funding that you have right now, what you're able to do, how long is that gonna hold you over? I mean, I know you said you're working to get it endowed and you need donations where you can. How long are you guys safe at GBMC? Safe might not be the right word to use, but
I think it's 3 years.
Roughly 3 years.
Yeah.
Okay. And do you think other hospitals and other places are looking at your model and thinking, hey, this is a good idea? I mean, you said you're the first one in this area to really take these steps.
So we're one of the first, and I think child life is wonderful. I mean, I love the profession. It's why I'm in the profession. But I think it's so imperative to have it in a community hospital, because like we talked about before, a lot of these cases, it's their first time bringing their child into a hospital, and it's kind of the window to healthcare. So if you can have a positive experience with a community hospital, they're most likely to keep using you as a community hospital and not be fearful to other medical institutions. A lot of pediatric-focused hospitals have very large child life specialists, or a large department. They're found in PICU, in the pediatric ICU, in surgery, in their main medical surgical floor. We are combined care. We're very small, so we currently are only supporting that one pediatric population at GBMC. So like I said, we do hope to move out. But it's imperative for the communities to have that support.
Absolutely. I mean, I'm not a doctor. I have watched a lot of doctor television shows, but they always make references about how they don't want to be the doctor the kid's afraid of. You know, you always hear those jokes like, I don't want to be the doctor that's known as the shot doctor or whatever, you know. So I feel like having a child life specialist, having someone there that can help bridge that gap and help them realize that it's okay. You know, this is something that's going to help you. That makes that whole process easier for the child and also for the doctors and for the staff there too.
That's kind of why we wear scrubs. So we are the pink ladies. Now there are men child life specialists out there as well, but currently we are the pink ladies at GBMC. And so we want to look like the medical team because we want to create a safe atmosphere for everyone on the medical team. And one of the most coolest parts of our job is having that patient be really excited to see that nurse or write that letter to the doctor thanking them for all the support they did. We're usually viewed as like the fun people, but we don't own that. Anyone can be fun. Nurses can be fun. Our staff is wonderful and great with working with the pediatric population. So we partner with them. So that's kind of, I don't know where I was going with that, but it's awesome. Yeah, that's... Well,
I will say the staff in general at GBMC, I was there a couple of months ago for a medical issue, and I had a long conversation with one of the janitors that came into my room to help clean out one of the garbage cans. We just sat there and chatted for about 15 minutes. Probably got him in trouble because he was standing in my room for 15 minutes, but no, very nice guy. I mean, I feel like everybody, the atmosphere is just pretty positive in general there. It's just one more added bonus to that. Kristin, how do you feel about letting Jennifer answer all the questions today? You feel good about that?
Yeah. She is the child life specialist. She knows the answers to all the questions.
She's been a good support. We've supported one another through this process.
We have a question. I see the big green sign. All right.
We do have a question. It's from Laura.
Okay.
And she says, good morning. Child Life has been such an asset to the SAFE program. And if she wants to, she also says she can't imagine doing the exams without their assistance. So she wanted to just reiterate that you're incredible and your team is incredible.
Oh, thank you, Laura. Her team is incredible. And I guess I don't know if I mentioned that we also are present during procedures. So not only do we prepare them for it, but we're going to ensure that we're utilizing their coping strategy that they developed, and maybe it really is working, or maybe their anxiety got the best of them and we have to change it up completely.
Sure.
So we're there actually, helping to help them get through the actual procedure. And with Laura's population in the SAFE program, we're there during the procedure as well. So maybe they, a lot of patients, like I said, like to keep their mind off of what's going on. They choose not to watch a procedure. So we might play a game on the iPad. We might do something else to keep their mind, divert their attention elsewhere.
And every kid is different.
Yes.
So, when you're in one exam room with a child and you go into another one, the strategy may have to change depending on that child.
Absolutely. That's why we call it individual coping plans. Yeah. What is going to work for one kid is not going to work for the other. And that's why the importance of us getting in there before things happen to meet them, see their temperament, their coping style, what has worked in the past, if they've had hospitalizations, what hasn't, so we can adapt.
Do you guys keep notes on that? If you have a child that comes in, does that go into the file that a child would normally have?
Yeah, so I'm terrible at this part of my job.
You don't want to admit that.
I know. No one else sees it. But so what we end up doing is we do chart in the medical record. So in case that patient comes back, we can see, this child really coped well with a lot of preparation before, or this child really didn't like to know a lot, or they did really well with bubbles. So that's the way we kind of, because it's not just me, there's a part-time child life specialist and also a PRN, and as needed. So we're all in communication of how to best support patients when they come back.
Oh, I see the big sign.
Yeah, good.
This is great.
We do have another question, and this one is good
from
morning.
Laura. Oh, no.
This one's not from Laura. This is from Smith Lovely Bessie.
Okay.
Good morning. Are there any classes or workshops that can teach parents? I think she probably means teach parents how to help their kids through an experience like this.
Was it Smith Betsy? Is that her name?
Smith Lovely Bessie.
Hello. Thank you for your question. So we, like I said before, we work with the entire family. So a lot of what we do is not just directed towards the patient. So I know we had a patient in actually last night during my shift, and I talked with the parent. The child was 2, I believe. And I let them know that, really allow the patient when they get home to play with medical equipment. They had a play doctor's kit that they just received, and just informing the family that kids process things through play. So allowing them that opportunity, things that they might see in their play. They might see some aggression, they might see some questions, or them like talking to themselves, working through things. So there's not necessarily classes to take, but I do encourage you, if you're in an institution where there is child life, to ask for the child life specialist and ask these questions to best prepare, and what to expect after hospitalization.
And again, I know we talked about this a couple times, but if someone's looking to find more information or looking to help out, maybe they want to sew one of these dolls while they're watching TV on a night, just do something while they're killing time. Where should they go? How should they get in touch? How should they find out information?
Yeah, so just comment on the Facebook Live event or the video, and I will get back to you.
Okay, perfect. Do we have anything else? I mean, is there anything that we missed? Anything else you guys want to talk about? No? We're feeling good? Yeah?
We're good.
Okay. Yeah. All right. Well, I just want to say thank you one more time. Jennifer Seiler, Certified Child Life Specialist at the Pediatric Emergency Department and Inpatient Unit at GBMC. Also, Cristin Bailey, Nurse Manager at the Pediatric Emergency Unit. Thank you both so much for being here, talking more about this. I think we've got a lot of good information out there. And just one more time, if you're interested in finding more information or if you want to help out, just comment here on this video and everything will be directed towards Jennifer.
All right.
Thank you so much.
Thank you.